Hi, my name is Jonathan Sutton, and today I'm going to be doing my informal speech on the long-term dangers of alcohol consumption. For my introduction, alcohol is often socially accepted and celebrated at gatherings, associating itself with fun and relaxation when you're out with friends. However, there lies beneath the surface of a far darker reality if you continue doing it for a long time and abuse alcohol over time. Alcohol has serious and at times irreversible effects on your health, assessment of which can be long term, and it can be physical effects, mental, and even emotional effects, and it can affect the people in your lives and how your relationship with them if it gets out of hand. Long term alcohol consumption has adverse effects on the human body and the mind, having implications for almost every system in the body and potentially reducing the quality of your overall life if you continue to abuse it. Today, we're going to look at the effects of chronic drinking on your health and the adverse consequences of alcohol on your mental health and the impact of chronic drinking on your social and emotional. So for my first point, I'm going to be doing the physical health consequences. Prolonged alcohol use will impact your major organs, particularly the liver, heart, and your pancreas. The first thing is liver damage. The liver is what processes alcohol, and but if you excessively intake alcohol, it can lead to inflammation, fatty liver disease, hepatitis, and ultimately cirrhosis. Cirrhosis is irreversible and can be even fatal at times. And the next thing is heart problems when it comes to physical consequences. Chronic drinking raises the risk of high blood pressure, cardiomyopathy, and even having a stroke. Even moderate long-term drinking can weaken your heart muscles, making the heart a lot less efficient over time. And another thing that comes with drinking alcohol, which a lot of people don't seem to know, a lot of people obviously assume smoking increases your cancer risk. Alcohol is arguably just as bad at increasing your risk of cancer. The International Agency on Research on Cancer classifies alcohol as a Group 1 carcinogen, meaning it's known to cause cancer in humans. Drinking increases the risk of mouth, throat, liver, breast, and colon cancer, according to the World Health Organization. And the visual aid on the slide is a diagram that shows the progression from a fatty liver to cirrhosis to liver failure. And for my second point, I'm going to be going over the mental and cognitive effects of long-term alcohol use. Damage to the brain is one of the main things that can happen. Alcohol over time, if you drink a lot of it, it always damages your brain. The health and mind and memory and learning defects. Alcohol acts against neurotransmitters, which are in your brain, and brain plasticity. Leading potentially to chronic impairment, memory loss, and cognitive deficits. Even if the patient has abstained in near time and in the near time mental disorders. The next thing is mental disorders. Chronic alcoholization is associated with depression, anxiety, and potential suicide even at times. This is somewhat paradoxical, as people who might ordinarily drink healthy over time, or as people that may drink and may deteriorate their mental health over time. And there even is alcohol-related dementia. There's studies out there that show that alcohol has a mix into what causes dementia if you do it a lot. And major drinking over time can cause you to become seriously addicted. And alcohol-addicted brain damage are about the same as the Wernicke-Korsakoff syndrome dementia due to a thiamine deficiency that happens when you drink alcohol. And here's a quote from the Cruise. It's alcohol is a neurotoxic. Long-term use leads to structural and functional brain changes. And for my third point I'm going over is the social and emotional impact that long-term drinking has. Chronic drinking can harm your relationships, work, self-actualization, and it can lead to your relationships and friendships going downhill. This usually occurs in individuals that are alcoholics, and it leads to a lot of problems. Some things that could stem that are emotional or social is there's a correlation between drinking and abusing your significant other. There's a lot of studies on that. It's a lot more likely if you're a chronic drinker. And ongoing drinking usually results in abstinence, lowered production, and a loss of jobs. Some people with alcoholism will find it hard to keep their regular jobs. They'll feel emotionally isolated, and with time, they may even separate themselves from their friends and relationships and push themselves away because they feel shame, guilt, or loneliness for drinking a lot, which feeds into the vicious cycle of addiction. And here's a quote from the SMAHSA in 2020. It says, "Alcoholism is an isolating disease, often cutting off patients from their critical support members like their family." And then, in conclusion, most often alcohol is associated with incubus fun. The story, however, changes when it comes to the long-term effects of alcohol. Chronic drinking can affect your critical organs, lead to mental deterioration, and isolates individuals socially and emotionally. It is only knowing such dangers that one can continue to educate themselves and others on the true cost of abusing alcohol. Knowledge is the first step to prevention, after all. And this last slide is my the sources I used for this. Thank you.